Hello, Skydi. Yeah. Thank you for joining. I remember yesterday, you dropped a question on the channel, but I was so tired that I had to get some rest. So, Skydi, welcome. Thanks for joining our live tonight. Wise Madine watching from Malawi. Thank you for always joining us, Wise Madine. Thank you for always joining our live, and I believe you are actually learning a lot from the live sections. Thank you very much. Kaidi, like I earlier said, you'll be the first person. If you drop your question now, we are going to take your questions as soon as possible. Good evening, everyone, and welcome to Nurses Lecture Room Live. On this our channel, we talk about health, we talk about sexual and reproductive health. We also talk about some fertility cases. So if you have any question, feel free to drop on the comment sections. We will be willing and ready to take all those questions for you, and we'll be able to give you generalized advice. So what I usually say is that for personalized health advice, it is very, very important for you to consult your doctor and get useful information. So Sky D, I will be waiting for your question. I'm just going to switch on that. I don't know if it's on. Sky D, we're waiting for your question. We have Okafo. Okafo Victex, how are you doing? Trust you are doing great. It's nice having you on our live today. We have Charles Wright. Charles Wright, how are you doing? I think this is the first time I'm seeing Okafo Victex, Charles Wright on the channel. I think they deserve some cheer for joining our live. Thank you very much for joining our live, Charles, from CA. Okafo Victex, thank you very much for joining our live. If you have any question, feel free to ask your questions and drop on the comment section. We have Isa Zachary. Isa Zachary, thank you for joining our live today. We really appreciate you. Thanks for always joining our live. We have Nurse Miracle. Nurse Miracle, how are you doing? Trust you're doing great. For me, I am doing perfectly okay. My kids are sleeping. And as usual, I am live to take your questions. So Sky D, I'll be waiting for your question. I believe you are typing the question now. We were supposed to take Sky D's question last night, but I was so tired because I have spent more than the stipulated time on the live section and I needed to get some rest. So I told him that I was going to bring it down today. So I think Sky D has asked his question. So please, if you have any question, one, feel free to drop on the comment section. We are ready to provide answers as much as we can. And if you are watching this live, double tap to like the screen. All you just have to do to like this particular live is to double tap on your screen and it automatically likes the video. Then feel free to subscribe if you've not subscribed to our YouTube channel, and also turn on the notification bell. Whenever we post a new video, you get the notification and tend to watch it. We have new videos in regards to the causes of ball pain, which is your testes, especially for men that are experiencing testis pain. We have a new video on our YouTube channel talking about that. Then we also have a new video talking about the causes of low testosterone. If you are a man, you are not, your sexual urges are down, you have low libido, your moods keep changing, I think it's very important for you to watch that causes of low testosterone. It's going to go a long way to help. Don't forget to subscribe. Don't forget to turn on the notification bell. And if you are watching, double tap the screen to automatically like the other video. So I'm going to be taking the question one after the other. The first question we're going to be taking is that from Skydy. So Skydy said, my wife have been receiving her period after she did a family planning every 3 days. It does not stop. Okay, it's not supposed to be so. She's not supposed to be seeing her period every 3 days. If this is continuous, I will advise her to go and see the doctor. Let her go back to the doctor or the place where she got that family planning method to actually get her test checked. Sometimes people react differently to some family planning. So that family planning method might not suit her. So what I would advise her to do is to go back to the doctor and find out why she is having bleeding. And if there is any need for the doctor to take out that family planning method, the doctor is going to do it. Okay, for her to be bleeding every 3 days, it's not normal. It's not normal. So that's what I would advise you to do. Skydy, let me know if you got the answer to your question. Hope I'm not too fast and hope you are getting me. Hope I'm not too fast, Skydy. Skydy. Sky, did you? Okay. If she's bleeding every 3 days, then she needs to see the doctor, especially if it is heavy. If it is very heavy, she needs to see the doctor. But if it's something like a spotting on her pants, it's not something to be worried about. I think we're done with Sky D. So if it's spotting, don't be worried. It's going to go over time. But if it is heavy bleeding, it is persistent, it happens every 3 days, then see the doctor from what you said. So we have another question. Debbie Mitchell said, I am not a nurse, but I pray God blesses on you all. Thank you very much, blessed Debbie Mitchell. We have Charles Wright. Charles Wright said, I have been watching. First time I spoke up. Thank you very much, Charles Wright. It's nice having you, and it's nice having you speak up. All right. I appreciate everybody that are watching, those that are watching and not speaking up, and those that are watching and speaking up. But feel free to ask your questions in the comment section. Like I will always say, it is a safe space. All right. So Isa Zachary said, good evening, nurse. How's the family? My question is this. Last week we talk on how to get a male child. So how about getting a female child? In terms of a female child is quite dicey in a sense that if you want to get a female child, it's advisable you have sex 5 to 7 days before your ovulation, or let's just say 5 days before your ovulation. So that's what is advisable, but it's dicey. It can't be 100% effective. But if you want to have sex, like if you want to give birth to a female child, you can try having sex 5 days before your ovulation, not on your ovulation day, not the day you are releasing the egg. Probably that might help. I don't know if that's clear, Isa. Skydi said, yeah. Gissy Modu said, so beautiful. Thank you very much. Skydi said, I get you right. You're welcome. Just One Day channel. Good evening, Just One Day channel. How are you doing? It's nice having you back on our channel again. Feel free to ask if you have any question. Miss Mary is here to take your questions. So we have Chisom. Chisom Anozie. Good evening, Miss Mary. Good evening, Chisom. How are you doing? It's nice having you all on the channel today. So we have Yinka Sahid. Yinka Sahid, good evening. How are you doing? It's nice having you all on the channel. So the next person is we have Iriri Precious. Iriri Precious said, hello, good evening, ma. Good evening, ma. Is it normal for someone to see her cervical mucus few days before her ovulation? It is possible, but generally the cervical mucus is like usually happens on the day of your ovulation. Generally, women have discharges from the vagina. As far it is slippery, it is not causing any infection, it is not inching, then it is okay and it's not something of concern. But if you are trying to conceive and you see cervical mucus, I will advise you take that day as a filter day and see how it goes. All right, because generally, like I will always say, some things affect your period and some things can affect your ovulation day. You get environmental factors are stress, medications can actually affect your ovulation day, can affect your period. So it's possible you are seeing that cervical mucus is actually your ovulation date, but maybe your calendar is telling you it's not yet time. So I think that's something you should take note of. Since you said few days before your ovulation, it could actually be your ovulation. Because when you calculate your ovulation, for example, it's day 7, they usually say plus or minus 2 days, plus or minus 2 measures, plus or minus 2. So I don't know if that is clear. Iriri Precious. Iriri Precious, if that is cleared, kindly let me know. Then we have Yinka Sahid. Yinka Sahid said, please, I'm early pregnant, but I'm having infection. What should I do? Okay, if you are having infection in early pregnancy, the first thing I would advise you is to get it treated. So I would advise you to go and see your midwife or to go and see your doctor. If it's a bacterial infection, your doctor is going to be prescribing some antibiotics for you. And if it is a fungal infection, the doctor is going to be prescribing some antifungal antifungal medications for you. Generally, I think antifungal medications are medications that can be getting over the counter. So it doesn't really require prescriptions. And one thing for you to note, it will show that you have yeast infection or some fungal infection is actually a cottage cheese discharge. So if you are having a cottage cheese discharge and also discomfort, it could be a yeast infection that needs some anti-yeast medication. But generally, since you are pregnant, I will advise you to go to your doctor so they give you some prescription. If you are sure you have infection, they are going to give you that prescription that's going to help you. Because with pregnancy, I don't advise you getting medications without doctor's prescription generally, especially when you are pregnant. It is very important for you to see the doctor, get confirmation, and get the useful prescription at that particular time. So Yinka, I don't know if you got the answer to your question. Yinka, yeah, you can see the doctor. Um, that's it, Yinka. I hope your question has been answered, Yinka. Yinka, let me know in the comment section. We have Sunday. Sunday is nice having you. Good evening, Miss. Here is Sonny from Lagos. Thank you very much, Sonny, for joining us from Lagos. And Sonny, have you done your assignment? We gave you an assignment yesterday, Sonny, in regards to you being more romantic to your partner, in regards to you being more romantic to your wife. I would like to know if you have been able to do one or two things and how did it go. Feel free to drop in the comment section. So just one day channel said, what is not practical way of knowing if someone is breathing or not when the person collapses? So one of the way to know if someone is breathing is that there's a rise and fall of the chest. If you have somebody in your room right now, if you have a child or your wife or anybody in your room, just look at their chest. It's breathing. It's going up and down, up and down, up and down, up and down. So that's the first way to know if somebody is breathing or not. So if you have somebody in that particular position, check, is the chest rising? You have to be like very observant. If you don't look very well, you might not notice. So that's one of the way to know if somebody's breathing. You see their chest up, like from here, you'll be noticing it is going up and down. Even from here, you see it like, I don't know if I can say, if I can do it, but just know that to know if someone is breathing, you have to do the up and down, up and down. There's a rise and fall of the chest. You can also notice it in the abdomen sometimes, but there's a rise and fall of the chest. That's how to know if someone is breathing. But if you have an emergency, please call 911 as soon as possible, all right? Don't administer first aid that you don't know. But if you have an idea on how to do the CPRO, that's cardiopulmonary resuscitation, that is going to go a long way to save that person at that particular moment while you are calling 911 or your emergency number over there. So I don't know, just one day channel, let me know if that is clear. Just one day channel, let me see. We want to believe a guy who said he feels like sleeping husband's wife also is touched by the Holy Spirit. So I don't really understand just one day channel. I'm going to go back to the next questions up. So just one day channel, your question has been answered. Emmanuel Uzo, how are you doing? It's nice having you on our channel today. Charles Wright said, if you don't mind me saying that you are a beautiful lady. Thank you very much, Charles, for the wonderful comments. I really appreciate. Yinka Sahid said, please answer. Yinka, I've answered your question. I don't know if you've gotten it. Emmanuel Uzo, good evening. How are you doing? So we have Margaret Chipilu. Margaret Chipilu said, hi. Margaret, how are you doing? Trust you are doing great. Yinka Sahid said, it's not inching me. I cannot use drugs now since depends. If it is severe, sometimes those infections can actually affect you. All right? Those infections can actually affect your full body system. So that is why you need to see the doctor. You get, if it's mild, it's not severe, then good and fine. You can deal with it. But if it's causing unnecessary discomfort, I will advise you get it treated, even if it's early, the early period of pregnancy. And what I would advise you to do is that, if possible, try as much as possible to allow proper ventilation in that area. That might help reduce that intense itching. Try as much as possible to allow proper ventilation, and then change your panties as regular as you can during this period to avoid recurrence. Then wash. Don't wash with harsh soap. Don't use any like soap to wash down there. Try and reduce any harsh soap. Just use water at this particular moment to always wash it. That might actually help too. So I don't know if you get that, Yinka Sahid. So Margaret Chipulu said, hi, nurse, how are you doing? I'm new here. Thank you very much, Margaret Chipulu. If you are new on our channel, my name is Mercy Mary. I'm a registered nurse midwife currently, and I'm a registered nurse midwife in Nigeria, but I'm currently practicing in the UK as a registered adult nurse. I'm a member of the UK YouTube Health. Yeah, so that's it. If you want to have any questions in regards to your health, sex, reproductive health, fertility, feel free to drop on the comment section. Though I am not a sex therapist nor a sex specialist, but I will be able to give you ideas in regards to knowledge from my midwifery expert. So that's Sahid. Iriri Pressure said, thank you. Yinka said, just 1 month. Okay, I think I've answered it. I told the doctor, she said I should be rubbing cotrimazole. Yeah, cotrimazole is an antifungal. It's an antifungal, so I will advise you to keep rubbing it since the doctor prescribed that cotrimazole for you. Like I earlier said, change your panties frequently, allow proper ventilation around that area. Change your panties frequently, allow proper ventilation, wash with just warm water or normal water. Don't use any harsh soap. That is going to go a long way to help. So I think we have a lot of questions here. I'm just going to see how I can take it one after a time. Both ketoconazole, and cotrimazole, they belong to similar class of drugs. They belong to similar class of drugs. While you are taking those medications, it tells you to rub on it. They are all antifungal. While you are taking it to rub it on it, practice those personal hygiene that I told you about. It's going to go a long way to relieve such itching. So Damila Sunday said, can you please elucidate the physiological and psychological benefits associated with fasting in the context of examination performance? Can you please elucidate the physiological and psychological benefits associated with fasting in the context of examination performance? Are you talking about fasting, like abstaining from food totally? And when you say in the context of examination performance in what sense? Are you talking about having an exams and writing it? So that's what I would like you to expatiate more. Fasting, staying away from food in the context of examination. Are you talking about writing an exam? Sorry, I don't really get what you're trying to say in regards to that. So Margaret Chipoli said, amen, watching from Ireland, Dublin. You're welcome. Oh God, I just pray, like, I hope, let's see what other questions. I don't want to leave one question unanswered. So that's why I'm going step by step. Please and please just stay. I'm going step by step because the questions are a lot at the peak. So Yinka Said said, okay, I've answered that. We want to believe the guy who said he feels like sleeping husband's wife also is touched by the spirit. Just one day channel, I don't get your question on that particular thing because it's not clear. Let's go. I'm going to go to the next. Emmanuel also said, please. Yinka Said said, yes, thank you. Thanks, ma. You're welcome. You remember the guy who says he always feels like sleeping with a cousin? I only know of someone that said he feels like, that dropped on the comment section the other time, that he feels like sleeping with his brother's wife. I can't remember. That's what I can remember. So Promise John, good evening, my beautiful nurse. Please, I want to ask you something, please. I'm having some sharp pains in my urine. Please, what could be the cause? It could be as a result of infection. So the best thing is to see a doctor to get it treated. It could be as a result of infection, and the best thing is to get it treated as soon as possible. Yeah. The sharp pains in your urine when urinating, I believe you are talking about sharp pains when urinating. So that could be as a result of infection. So it's advisable for you to get it treated as soon as possible. So that's what I would advise you to do, Promise John. Sunday said, indeed, I have received her affirmation. She has lovelily confirmed that for us, that I should go and learn. All right, Sunday, I actually wish you all the very best in that. I wish you all the very best. Okay, Yinka Said said, I'm not even wearing it again. Okay, that's good because at least ventilations are going to take place there, and always wash up frequently to remove any. So please, what is the meaning of cerebrospinal meningitis? Okay, cerebrospinal meningitis, when you say cerebrospinal meningitis, how will I put it now? I don't know if you're a medical student, but meninges, there's something called meninges. Meninges is the covering of the brain. It covers the brain. I think it also covers the spinal cord. So when there's an inflammation of the meninges, it is known as meningitis. And for it to be cerebrospinal meningitis, it simply means that it is related to the cerebrospinal fluid. I don't know if you get now. So it's related to the cerebrospinal. I don't know if just one day channel is a medical student. That's the best way you'll be able to understand it, because cerebrospinal meningitis simply tells you that is related to cerebrospinal fluid, and meningitis is the inflammation of the meninges. The meninges are more or less like the protective structures. I see it as the protection of the brain. Like they have three layers of meninges. We have the dura, the arachnoid, and the pia mater. The dura, the arachnoid, and the pia mater. So when there's an inflammation of these meninges, it causes meningitis. And since it is cerebrospinal meningitis, it simply means that it is around the cerebrospinal fluid and all that area. I don't know if just one day channel understand what I am saying. Just one day channel, let me know if you understand that. I'm trying to take the questions one at a time. I don't want to miss anyone. So indeed, I have, okay, I think I've done that. Yinka said, thank you so much, ma. Yinka said, all right, ma, okay. Rakiatu Kasim, please and please, when you ask questions, just stay till your questions get answered. When you ask questions, stay till your question get answered, because I still have a lot of questions I have to go. So when your questions come, it may take time to get to your turn, but I'm definitely going to answer it. And you can also learn from other people's questions. So Rabiat Kasim said, good day, ma. God bless you. How to treat dryness? I believe Kasim is talking about vaginal dryness. One thing is that dryness can be caused by different things, and the cause actually determines the treatment. So if it is not related to any medical condition that is causing that your vaginal dryness, so one thing I would advise is a lot of foreplay at the beginning of sex, a lot of foreplay at the beginning of sex. If the dryness is as a result of some hormones, as a result of a time in the cycle, I can also advise the use of lubricants. Lubricants can also go a long way to help in regards to that. But I think if you've not watched our full video talking about causes of vaginal dryness, I will advise you watch that video, because it explains in details what vaginal dryness is. All right. So Rabia to Kasim, what I would advise you, if it is not, if the dryness is not as a result of infection, is not a result of any underlying medical condition, I would advise a lot of foreplay and also the use of lubricants, because lubricants can go a long way to moisturize it and make ejaculation much easy. So sometimes at the beginning of sex, some people may be dry, but with the help of lubricants, after penetration, they tend to release a lot of fluid, more fluid that carry on throughout the sexual intercourse. And like I will always say, as a lady, there are some particular time in your cycle that you experience this dryness, that you don't feel wet, that you don't feel the mood for sex. It is normal, because a lot of things take place during your cycle. So I don't know if Kasim is here to listen to the answer to her question. So I'm going to go to the next question. Emmanuel, I can't find your question. Emmanuel, I can't find your question. So Margaret said, I am pregnant for 9 months plus. I did 8 scans, and all scans comes out negative. And my pregnancy is growing big, and there are some movement that can cause the babies not to show. Please, I need your advice. You are pregnant for 9 months and you've did 8 scans, and the scans comes out negative. That means the scan is showing you are not pregnant, right? If the scan is showing you are not pregnant, generally medically, you are not. If the scan is showing that you are not pregnant, generally you are not. And if you now do a pregnancy test using the urine and the blood, and you are not pregnant, it simply means that there's something called false pregnancy. False pregnancy, I think I've made a video about false pregnancy, where some women feel they are pregnant. Sometimes they experience the growing abdominal region, they feel the baby moving, but there is no baby. So it could be false pregnancy. False pregnancy, you start having pregnancy symptoms, whereas you are not pregnant. So Margaret, if the scan says you are not pregnant, it could simply mean that there is no baby. So what I would advise you to do is to go back to the doctor and express your fears to them. Let them know how you feel, because and also if you are not seeing your period, if you are seeing your period for these 9 months, that also shows that you are not pregnant, Margaret. So I'm sorry about that, but that's one thing I want you to know, because there is something called false pregnancy. In false pregnancy, there's this feeling you start, some even vomit, like the nausea, some have chest burns, some have their abdomen get extended, they start feeling baby movement, but there is no baby, there is no pregnancy. All right, that could be false pregnancy. Since you've done 8 scans and the 8 scans said there is no pregnancy, I especially when you're trying to conceive. I know how, like, I don't know how to say this, but I know how heartbreaking it can be. It's possible there is no baby. It is possible there is no pregnancy. So what I would advise you to do is to actually go back to the doctor and let them explain why it is like that. Let the doctor explain what is happening. So why ask the doctor, so if I'm not pregnant, why am I having extended abdomen? What are you people seeing in the scan? Let them tell you what they are seeing in the scan. Because you're having an extended stomach, you're having an extended abdomen, but yet the scan keeps saying there's no baby. So it is time for you to have a chit chat with your doctor to actually confirm what is really wrong, why you are having an extended stomach and there is no baby. So that's my personal advice, Margaret, and I pray everything comes that way, and I sincerely wish you all the best. Okay, Margaret? Margaret, I hope you got the answer to your question. So I'm going to go back to the next question. Yinka said, Miss Maki, I sincerely appreciate your assistance. Furthermore, I have engaged with additional resources regarding to romantic gestures, and I am committed to implementing this practice without delay. It is very important. Like, to build a healthy relationship, to get a submissive wife, you have to be romantic. And I'm glad you are taking the move, and I wish you the very best in your marriage, in your relationship with your partner, and I pray everything turns out well. So just one channel said, yes, the brother's wife, thanks for the remembrance. I think we've talked about that the last time, and I told that particular guy that if you're having that mindset of sleeping with your brother's wife, sometimes it might just be thinking that, oh, I want to sleep with my brother's wife. And you might just be thinking it, but you've not accomplished it. So the best thing I advise that person to do is to stay away. If they are living in the same house, try and get away from that house. Because when you have that thought, before you know, even if the wife is not interested in you, the man will see himself forcing himself on his wife. So the best thing I would advise you to do is to stay away from that environment where your brother's wife is. Go somewhere far. Don't stay in the same house. Don't stay in the same streets with your brother's wife that you're having a crush on, that you're having sexual mindset or sexual advances on. So stay away from your brother's wife, anything close to them. So that's what I said in the last section. If you're having like this sexual desire for your friend's girlfriend, for your friend's wife, for your brother's wife, stay away from them, because you might not know what's going to push you to rape someone. That's why you see incidents of rape. It happens if you're having sexual attraction towards a kid, like pedophiles. It's very important for you to stay away from those child to avoid putting yourself in trouble. Okay, so that is what I have to say. Just one day channel. So Promise John said, okay, thank you so much, you're welcome. Yinka said, okay. Yinka said, hope it won't affect my baby, but I'm scared. It won't affect your baby. That's why I said you should keep up with the doctor's treatment, which is the clotrimazole and the drugs that you're rubbing on it. Probably the doctors feels that it's actually a yeast infection. That was why they gave you that prescription. So just keep up with the treatment, do a personal, like your personal hygiene, and see how it goes. If there is no improvement and it is creating unnecessary discomfort for you, go back to the doctor. So that's personally my advice. Oh my God, it's a lot of questions today. I didn't really expect I was going to see a lot of questions. Your baby will be fine, but infections generally is not good in pregnancy. So Isa Zachary said, Nurse, please help me out. She just finished her period, but I've forgotten where I put down the ovulation date we calculated the other day. So please help me with the dates. Zachary, we calculated our ovulation day. Okay, what's going to happen, Zachary? I'm just going to finish up with all other question. Then I will scroll back to your question. I'll finish up with other question. Then I'll scroll back to your own calculation. What I would advise you, just stick around. When I finish with the questions, I'm going to scroll back to your own question. Please elaborate on the peer matter. Like we have, I can't remember my physiology probably, just one channel, but I know we have the dura matter, the arachnoid, and the peer matter. I think the peer matter should be the innermost, and the dura should be the outermost part of the meninges. So I can't really remember, except I go back and revise the physiology to understand that meninges again. I know we have the dural, the arachnoid. There are layers of your meninges. There are layers of your meninges that protects the brain. So they are like a covering to the brain. The meninges, they are protecting the brain. So that's what I can remember vividly from my physiology. If I go over my textbook again, I think I'll have a better knowledge of what the meninges are and how it works again. So Igodaro Gladys said, "Good evening, Ma. Ma, I want to know someone who have polycystic ovary and fibroid of 5 cm. Can someone get pregnant with it?" The fact is, yes, you can get pregnant with it, but it is a bit dicey. Yes, you can get pregnant with PCOS. Yes, you can get pregnant with fibroid. One thing is that when it comes to fibroid, you can get pregnant with fibroid, but it depends on the location of the fibroid, the type of fibroid, how big is the fibroid. That's what is going to determine if the baby is going to stay. Because some people, if the fibroid is big, if the location of the fibroid is in a particular position, it might actually cause miscarriage in the long run. So you can get pregnant with polycystic ovary syndrome, which is PCOS, and you can also get pregnant with fibroids, but a lot of factors are surrounding it. Generally, it's when you have PCOS and also when you have fibroid, it kind of puts you at risk of infertility. But that doesn't mean you cannot conceive with it. It puts you at risk, yes. It puts you at risk in the sense that if others are having 100%, you might have 80, you might have 70%. You get, but that doesn't mean you can't conceive at all when you have PCOS or when there is a fibroid. You can conceive, you can actually have a child, but it's a bit dicey because with polycystic ovary syndrome, you don't know your ovulation day. So it's more or less like a try your luck thing you'll be doing because you don't know your ovulation day. But if you have these conditions, I would advise you actually speak with your doctor as soon as possible, especially when you're trying to conceive. If you have these conditions, I would advise you speak with your doctor, not just any hard doctor, but those that are involved with women, your gynecologist, your O&G doctors, your obstetricians, your gynecologists, the fertility experts. Let them know on time. If you have the finance, go and see them as soon as possible, especially if you are trying to conceive at that particular time. Go and see them as soon as possible and take appropriate advice from them in regards to that. Because the earlier you see them, the earlier they start guiding you through, the earlier you get pregnant. Because if you keep delaying it, like, oh, I want to keep trying my luck, I want to keep trying my luck, it might take longer. But if they start guiding you, they start giving you some medications that are going to help with your ovaries, they start giving you some medications that are going to help, it's going to go a long way. So the earlier you do it, the younger the age, the better for you. So that's what I have to say, Igodaro Gladys, and I hope that helps. After Igodaro Gladys is, what is the medical value of fasting before an exam and then taking the exam? I don't fasting. What kind of exam? Wait, are you talking about school exam? If you are having an exam, I don't advise you fast. You have to be careful. Is it examination like physical examination? You're going to the hospital. I think your question is not clear, Sunday. But generally, I don't advise people fasting before going for an exam. Personally, I feel you need a lot of glucose. You need a lot of energy to actually think and write an exam. If it's a school exam, you need a lot of energy to think. You need a lot of glucose. You need your brain. Your brain needs glucose to actually write an exam. So I see no reason why you should fast when you have an exam. I see no reason why you should fast when you have an exam. If it's to take a cup of tea in the morning, at least you need that energy. It keeps your brain going. So personally, I don't think I will go for an exam without having a cup of tea at least, because I actually need that energy to carry on. So that's that. I hope that is clear. So we have don't know if this question is acceptable. How do one apply strawberry scented condoms during sex? Does it have any effect? Personally, I don't advise you go for scented condoms. I don't advise you go for scented condoms. I advise you go just natural thing, because when you start putting too many things in things, it just spoils it. It's just spoils its natural function. Leave the strawberry alone. Get your normal condom. I think the strawberry scented condoms are just for good fragrance, like a perfume, just to make everywhere scented. I think I have to make a video on that strawberry scented condoms. If I advise it, I don't advise strawberry scent, except you're not comfortable with the vaginal smell except you are not comfortable with the. Generally, the vagina is not supposed to smell fragrance. It's not supposed to smell like strawberry or vanilla. You get. So, except you're not comfortable with the smell for the vagina, that's why some people try to use the scented condoms. I think because I have not really heard about scented condoms. I don't know why, but this is the first time I'm hearing about it. So I'm gonna do my research about it and see. But I advise you using a normal condom rather than the scented one, because the more things you put in your vagina as a lady, the more you alter your vaginal pH. So I don't advise that personally. But I've not read about scented condoms. I'm just hearing it for the first time. So Kasim said, thank you very much, ma. You're welcome. Yinka said, please, ma, I want to know, hope it won't affect my baby. Your baby will be fine. Your baby will be fine. As far you've seen the doctor and the doctor prescribed some medications for you, which you are taking, definitely your child will be okay. If it's something serious that requires some antibiotics, the doctor is going to give you some antibiotics that are friendly for you and the baby. So for the doctors to give you colchimazole, I probably think the doctor has examined you, and from what you've told him, he feels that is the best medications for you. Margaret Chipley said, I don't see my period, ma. It's possible for that to happen too. So, like I earlier said, Margaret, I will advise you to go and see your doctor, have a conversation with him. Because for scans to show that there is no baby, it simply means, I don't want to deceive you, it simply means there is no baby. If there is a baby, it's definitely going to appear in the scan. So for scan to say there is no baby, except it's something I'm not aware of, except something is happening that I don't have knowledge of. If the scan say there is no baby, generally there's no baby. If there is a baby, it's definitely going to appear in the scan. So that's one thing I know, Margaret. Nika said, my name is Asiat or Folashade. I'm using my husband's name. That's why you are seeing Yinka Sahid. Okay, all right, Asiat. It's fine. It's fine. I hope your question has been answered. Okay, that's fine. That's fine. I hope your question has been answered. Please, if your question has been answered, kindly let me know in the comment section. Oh my God, that was loud. Okay, I hope I'm not missing any question. Okay. Rabiatu, yes, ma. What question did Rabiatu ask at first? I can't remember your question again. Please don't mind me if I can't remember your previous question, though. It's not my fault, though. Please don't remember. Okay, dryness. Okay, you talk about dryness. All right. Rabiatu asked about dryness. I think that was the question she asked. So Rabiatu is asking another question because I saw yes, ma. Rabiatu said, yes, ma. My breast nipple hot. What is the cause? Are you breastfeeding? That's one thing that can cause breast nipples to hurt. If you are breastfeeding, it can actually cause your breast nipple to hurt. And if there's a skin condition like eczema, that can cause your breast nipple to hurt. If you are breastfeeding, if you have eczema, if there's that skin condition like eczema, dermatitis, allergic reactions, that can cause your breast nipple to hurt. Hormonal imbalance, infection can actually cause your breast nipple to hurt. So that's it. I don't know if that helps, Rabiatu. So Yinka said, I will see my daughter. Okay. Ngozi Sabina. Hi. Hello. How are you doing? So Oza, Medskin, Informasia, Million. Have you heard of Peyronie's disease? I think Peyronie's disease affects a man's sexual head. It causes the penis to curve. Yeah. It causes the penis to bend. when it is erect. So normally, when the penis is erect, ought to be straight. But with the Peyronie's disease, the penis becomes bent. So I've heard about it. I've heard about Calame syndrome. So I don't know if you want me to explain it. Do you want an explanation for it? You're asking me a question if I've heard about it. So Peyronie actually causes the penis to bend. So a school exam. Sunday, I think I've answered your question. The fact is, if you have a school exam, I don't advise fast. At least take something so that your brain will have glucose. So that's what I generally advise. So Igararu said yes. Yoko said hi, ma. Said hi. Hi, good year. Hi, Mambo. We have a lot of hi. Rabiatu said, I'm not breastfeeding. You can check if there's anything like eczema, dermatitis around your nipples. You can check that. Then you can check if you have infection, even hormonal imbalance. You know, you complained of vaginal dryness. That vaginal dryness can be as a result of some hormonal imbalance. And that hormonal imbalance can actually cause the breast to hurt. So if you can go to the hospital and do this, is it hormonal profile, they call it, just to check your hormones and see if there is any hormonal imbalance. Because you are complaining of nipple pain and you're also having vaginal dryness. All right. So I think I'm not saying you asked the question in regards to vaginal dryness and also nipple pain. So that's what it could be as a result of some hormonal imbalance in between. So Rabiatu said, no, I'm not breastfeeding. I think I've answered that. Then Igodaro Gladys, thank you very much, Ma. You're welcome. So I think I said I was going to Zachary, if you are here, just let me know so that I can. Zachary, if you are here, I want to answer your question now. Zachary, because you asked the question, I was like, I have to finish answering all the questions before I answer yours. That penile fibrosis is related to perineal disease. You're asking the best way to fix penile fibrosis. Penile fibrosis is related to the other thing you called before. One thing is that at the early stage, they might use medications, but in the later stage, surgery might be the only way to fix it. So the best thing, I think Oza Medic Informacia will advise you see your doctor, because at the early stage, your doctors might prescribe, depending on how severe it is, depending on how far gone it is. At the early stage, the doctors might prescribe some medications to help with it. But in the later stage, they might recommend a surgery for it. Zachary, if you are online, let me know. Zachary. So Godia, hi, how are you doing, Godia? Ebrima Tikora, how are you doing, Ebrima? If Zachary is online, just let me know. Let me do the calendar here because I might need the calendar to calculate for Zachary the ovulation day. My daughter actually threw away the calendar I had on my. Just let me know if you have any question. 12, 13. Do we have any questions? We still have like 15 minutes to spend on this live. And if Zachary is here, Zachary should drop on the comment section so that we can calculate the cycle for him. All right, if you are coming across this channel for the first time, my name is Mercy Mary. I am a registered nurse midwife and also a member of the UK YouTube Health. So on this channel, we talk about health. We try as much as possible to see how we can help. And if you are new, feel free to subscribe to our YouTube channel and turn on the notification bell. And if you are watching right now, double tap the screen. Just tap on your screen twice. 1, 2, and it automatically likes the video. So that's all you need to do to like the live section. Double tap on it twice and it automatically likes the video. If you have any question too, feel free to drop in the comment section. I am willing and ready to take the questions, okay? So we've answered a lot of questions today, like a lot, I would say. So we have like 15 minutes to end the live. Zachary, are you back? So Stephen is asking a question. Is it healthy to keep your body hair? Yeah. I think the hair in your body has functions in the sense that they are protecting your skin. It is healthy to keep your body hair, but depending on the location of the body hair. Because sometimes when there are too much hair in a particular location, it is not healthy and it is not nice. But generally, it is healthy to keep your body hairs. Okay? Favor Ifyong, how are you doing? Trust you are doing great. Favor Ifyong. Steve, did you get the answer to your question? Okay, Steve said yes, thank you. It is healthy. It is healthy to keep your body hairs. All right? At least when there is cold, it's something that will keep you warm. But I think a lot of people are not comfortable when it's really very hot. So if you live in a very hot country, you might not be comfortable you might not be comfortable with it. So Favor Ifyong, hi. Stevie said thank you. Wada said hi. Wada, how are you doing? Misha, how are you doing? Trust you are all doing great. If you are watching this video for the first time, my name is Mercy Mary. I am a registered nurse midwife and also member UK YouTube Health. Feel free to subscribe to our YouTube channel. Feel free to double tap the screen. Just tap the screen twice and it automatically likes the video. If you have any question, feel free to drop in the comment section. And Zachary, if you are back, kindly let me know so that I can calculate the cycle for you. Favor, if you're, I'm good, ma. Thank you so much. You're welcome. Do you have any question for us, Favor? Do we have any question? Feel free to drop in the comment section and also double tap the screen to like the video. We've been answering a lot of questions and I always need to rehydrate. So Oza, I didn't get your question because you are not writing it in the language I understand. Personally, I've not had a male patient that have developed any complications. It is possible for male patient to develop complications with catheterization, but personally, I have not had a patient that I had to catheterize and they develop complications. But complications can arise from catheterization, but I have not experienced that. I've not experienced that complications from catheterization. Do we have any question for Nurse Mercy? We have 10 more minutes to go and this live, because my live is usually for 1 hour, 10 to 11. 10 to 11 is usually my live section. Feel free to double tap the screen to automatically like the video. Feel free to double tap the screen to like the video. That's going to go a long way. When you double tap the screen, it just kind of automatically likes the video. You don't need to do anything. Just tap the screen twice and it likes the video. And if this is your first time of coming across this channel, feel free to subscribe and also turn on that notification bell so you don't miss out when we pop a new video. Then Zachary, if you are back, I keep calling your name, but I'm not seeing you. If you are back, kindly let me know. Someone is asking, please, what is the alternative for a baby who has allergic to cow milk? So there are different type of milk. Aside cow milk, we have the soy milk, we have soy milk, we have the almond milk. Soy milk is gotten from soya milk, soya beans. Yeah. So you have soya milk can go. Almond milk. I think kids can take almond milk. Yeah. Almond is rich, is healthy. That's another alternative. Then Hope is not a newborn baby. Please and please. Hope is not a newborn baby. Before I start saying, Hope is not a newborn baby. Please let me know in the comment section. How old is the baby? How old is the baby? How old is your baby? Okay, yeah. So she can take that milk I just listed. Then there's something called oat milk. I think you should, when you go to a shop, you can actually check for other alternative to milk, not just cow milk. And also your baby might be maybe lactose intolerant. There's what we call lactose intolerant. You can get milk that don't have lactose in them. That can also help. I don't know if that helps favor. But soya milk is very, very healthy. I advise soya milk. Yeah. If you can get soya milk, I will advise it because it is very, very rich. Soya milk is very, very rich. That's one that I feel might be easily accessible for you. So Kasim said, how do you know if you are pregnant in the early stage? One, the first thing is missed period. You missed your period. So if you missed your period, that's a sign. Then early stage pregnancy, you have nausea and vomiting. You either nauseate, some people nauseate, some people vomit at the early stage of their pregnancy. Then we also have, what are the early signs of pregnancy again? They might be irritated by smell coming out, positive pregnancy test. So when you missed your period, the next thing is to check for to do a pregnancy test. Then you might start having signs of malaria. For those that are in Nigeria that know malaria, you might just any stage of pregnancy signs are similar to malaria signs. So I think that should give you a clue on how it should look like. Rabiatu, if that is clear. So, how do you know? Oza said, have you heard that some men enjoy urethra insertion? Sorry if it's an all. I've not heard about that, but I know it's quite painful. But with the help of lubricants, it makes it easy for the healthcare practitioner to help with the catheterization. So that's what I have to say. So Yinka said, when can I take TT injection because I'm a week gone? I think I can't remember. I can't remember because all my pregnancies have been in the UK. I think it should be around the 27th week of pregnancy here, but I don't know back home. So what I would advise you to do is to ask the midwife. I can't really remember the actual time, but I don't expect it to be very early. It's not early pregnancies, so that's why it's very important for you to register for antenatal on time, because when you register for antenatal on time, like they follow you up. They let you know when your TT injection is due. They let you know any other updates they want you to know. So that's why I advise you register for antenatal on time, because different country, different policies, different things. So that's why first thing I would advise you to do, if you are a month gone, you're already 8 weeks, I would advise you to register for antenatal. Zachary here. Fiance, thanks so much, but I think she's also allergic to plant milk because I tried tiger nut for her and it flares her skin up. Okay, what I would advise you to do if you notice that she's allergic to this thing, if there's a way you can still continuously express, I will personally advise you see how you can express your breast milk if it's possible for you to express your breast milk. She might not be allergic to your breast milk, so express your milk and mix it up with her food. That's what I would advise you to do since you notice that she's allergic to plants and cow milk. So why don't you try expressing and see how it turns up? Except expressing is difficult for you, you can get a breast pump to see how you can massage your breast to release some breast milk. So when it comes, instead of you using the cow milk for the baby, you can use your breast milk. So that's what I advise you to do. Are you still breastfeeding? Favor, are you still breastfeeding your baby? Personally, I do encourage breastfeeding for like up to a year, but mine is not always the case because my kids, I've noticed it even with this my second baby. Immediately I like they test something, they test formula, immediately they taste formula or they taste something, they stop breastfeeding. So most times my breastfeeding doesn't even get to 7 months and they've stopped. Generally I recommend it. I advise people to breastfeed for as much as they can, but my kids are quite different. Immediately they taste formula or they taste something, they just stop breastfeeding. So I don't really have difficulty stopping them from breastfeeding. Though I'm not happy, sometimes I want them to elongate it a bit, but it's not my fault. Immediately they test something else, they just stop breastfeeding. So that I don't know why. I don't know why my kids are different. It happened for the both of them. It happened for my daughter. Immediately I stopped breastfeeding her, she stopped. It happened for my son. Immediately I introduced something else, they just stop breastfeeding, and before you know, everything dries up. So if you are still breastfeeding, I would advise you to do some express. Try and see if you have if you have a way you can store them in case you are not available, then use it to mix their food since you know they are allergic to it. So if you are still breastfeeding and the breast milk is still coming, just express it, keep it, store, and always use when you need till they finally stop. So that's what I would advise you favor. At least it's saving you some money, saving you some cash. More stress, but less cash is being spent. Like my 6 months old now, it's so funny how he drags whatever I'm eating. I don't know about you. Kids are quite different. My 6 months old is a whole lot to do with. I'm eating toast bread he wants to eat. I'm eating strawberry he wants to put in his mouth. I'm eating even chicken he wants to drag the bone with me. So I just give him and it's just that you can start introducing them to different varieties of food. It's not bad. Start introducing your child to different varieties of food. Since you know this particular child is allergic to milk, though milk is generally good. So the best thing is breast milk and alternating it with the normal food available. So that helps with it. I hope that is clear, favor. So it's 1 hour. We spent 1 hour on this live. And I think we've done a lot for today. Oh, we've done a lot for today. Zachary, I didn't get you. I was calling your name. I didn't say it. That's normal. Godia, it's normal. If it's before your period, you notice it is something that happens before your period. It's normal. My nipple always pay me before my period comes. If this particular thing happens, usually happens before your period, you notice it's not something that like stay for long. It's not something that stay for 2 months, consistent pain. It's normal. It's just your body way of telling you your period is coming. Okay, so that's it, good. Yeah, and I hope that answers your question. So if you are watching this live, the live is about coming to an end. I will appreciate if the next 2 people just double tap the screen to like the video. All you just have to do is not going to take you anything. Just double tap the screen twice, and it automatically likes the live section. All right. And if you are new on this channel, feel free to just click on the subscribe button and turn on the notification bell, so you don't miss out when we drop a video. Double tap the screen to actually like the video. Yinka Said said, yes, it happens to me too. Okay, I thought I was the only one though. What happens to you too? Is it the pain or something? All right. So England won the football. Congratulations to England. Congratulations to England. They won the football. Congratulations to England. Who were they playing against? Sorry, let's do some chit chat. Who was England playing against? I'm not a football fan, so I don't even know where people are playing, but thank you very much for making the like up to 20. I really do appreciate it. Even 21, thank you very much. Okay, sorry. Okay, nipple pain. All right. If it happens like before your period, then it's nothing. Except it's if the pain is consistent, like it's been there, it doesn't go away, it's just there. But anything that is repeated, it happens every time before your period. So it's just your body way of saying your period is coming. So that's your body's way of giving sign. So downward weight loss, who did England play with? I believe that was where you are or where you were. That was how you didn't join our life today, downward weight loss. But anyway, thanks for coming and giving us the updates that England won. But I would like to know who England played with today. Please, can you tell me in the comment section? Who did England play with today? Yeah, if after period it goes, it's your period related. So it's not complicated. It's your period, so it's fine. Who did England play with today? The life is coming to an end, but I wanted to know who England played with before I end the live section. Godia said, I don't know if I'm seeing my ovulation or not. I think you should watch out. Are you menstruating? If you are seeing your period every month, that's a sign that you're ovulating. Yeah. If you are seeing your period every month, that is a sign that you're ovulating every month. But if you are not seeing your period every month, that's a sign you are not ovulating. So for you to see your period every month, that's already a high sign that you're ovulating. All you just have to do is to track down your ovulation to know the exact dates. If you know you're ovulating every month, definitely you should be seeing your ovulation. So what you just need to do is to track down by keeping track of your cycle and calculating your ovulation cycle or your menstrual cycle, and you're able to know your ovulation day. So that's what that is it. So Diamond Weight Loss, I think Diamond Weight Loss has left. She's supposed to tell us who England played with because I'm not really a fan of sports, but I'm in England, so I celebrate their victory. Congratulations to England as they take the cup, as they won the map. I don't know if it's cup they are playing for actually. Yika said, but now I'm pregnant. It's paining me and little somehow strong. This could be early signs of pregnancy. Yeah, it's early signs of pregnancy. It's early signs of pregnancy. It's early signs of pregnancy. It's early signs of pregnancy, Godia. If you are seeing your Godia, if you are seeing your period every month, definitely you are. If you are seeing your period every month, definitely you are ovulating. Godia, then you are ovulating. There's nothing to be worried about. Just for you to track down your ovulation and know the day you are ovulating. I don't know if I'm seeing my okay. Well, right now I'm pregnant. It's paining. I think Yinka, the pain is supposed to last for like a few weeks. After some like 4, 5, 6 weeks is gone. So if the pain is not going, you can just ask your doctor if there's anything he needs you to do about it. So Yinka Said said, okay, ma, thank God. You're welcome. Yinka Said said, I'm so happy to join this live. Thank you for joining the live. And if you've not liked, all you have to do is to double tap the screen to like this section, to like the video. As I end this live now, I'm going to see you all in my next live. Our live is usually from 10 p.m. to 11 p.m. every day. So for those that are just joining, I'm sorry I'm not be able to take any other question again till tomorrow by 10 p.m. So feel free to join our live section tomorrow by 10 p.m. I will be live tomorrow to take your questions. I'm sorry it's late. I need to get some rest. So I'm working with time. So I can't stay longer than this. Bye, everyone, and see you in our next live. Feel free to double tap the screen to like the video. Feel free to subscribe to our YouTube channel if you've not done so. And if you subscribe, turn on the notification bell so you don't miss out whenever we pop a new video. Thank you, Rabiatu. Thank you, Yinka. Bye and see you in our next live.